Yeah, hello and welcome to Wimpole Street Dental Clinic. My name is Chris Jamel, and in the following video we will show you a very special technique how to do adhesive bridges, or so-called Maryland bridges. These can be used in case when you, for example, you're missing a front tooth and you don't want to have surgery. So this is a very simple but technically sensitive treatment. So we hope that we can convince you with this video, in case you don't want to have implants, that you can go for this treatment. So please enjoy the video.
You can see a typical situation of a patient with congenital missing teeth. Typically, the lateral incisor is missing with a 2% chance. So of course you have several options to treat that. You can either leave it or place a denture, which is not what most patients want. You could place a bridge, but that would mean drilling down the teeth. Or fourth, you could place an implant, which is sometimes not a very good idea if you are at a young age, because the implant will not grow with the bone. So the best options in this case, or the best option in that case, if you have teeth which are not decayed, can be the so-called Maryland bridge. The first step for that is to place the teeth in a correct position, as you have seen here with orthodontics. It is very important that the gaps between the teeth are of a correct size, so that we can place later on the correct size of the tooth or teeth. If you have to change the teeth a little bit, you can use composite, as we did here for the two central incisors between the teeth. If you want to make small corrections, for example here on the top right of the picture, removing a little bit gum, you can do that, but it's not necessary. If you have the gaps in the correct size and adjusted your soft tissue or placed composite fillings to have a better shape of the front teeth, you produce a model, and then the dental technician in turn produces a so-called wax-up. That wax-up will be put into the patient's mouth with a silicone splint, so that we know exactly how much we have to prepare away from the teeth. Then in the next step, the teeth will be defatted using alcohol and painted black, so that we exactly know where we took away tooth material. And then ever so slightly the tooth will be prepared, so that the technician has an exact line where the future bridge will end. It is very important not to extend the preparation too far to the buccal or labial side, as you will then be able to see the framework of the tooth to be replaced. After we have prepared the tooth, we will take an impression. The impression is the prerequisite for the technician to produce the framework seen in this picture. With modern techniques, normally you don't need to check that anymore. Most of them will fit. The frameworks are made nowadays of zirconium dioxide. That is very important. And this is the only framework material which will last you for a long time. And then you can see here the final work, which we were not happy with, because if you have a black and white analysis, you can see that the tooth axes are not quite right. The gum line is not quite right. And the level of the incisal edge of the teeth is not quite right either. So we gave the work back to the technician to amend it, because the patient, and we of course as well, wanted to achieve the perfect work. After these changes have been made, the Maryland bridge and for the small tooth, for the mesiodens, the small crown is bonded permanently into the mouth. You can see here the situation of the upper jaw from the back side of the upper jaw. On the right side, on the right picture, you can see the framework bonded to the front tooth, and the small veneer or partial crown on the other tooth. And you can see here the final situation directly after placement and the smile line directly after placement with a satisfying situation for the patient. Of course, you can replace teeth in the backside of the mouth as well with adhesive bridges, but we do not have long-term data for that, especially with full ceramic framework. Here, a small example, how to replace a premolar with a adhesive bridge. With this technique, you do not have to prepare to take away that much of the anchoring tooth. You can see here the situation on the model. Thank you very much for your kind attention.